Judy Maturano with NVSHP, President 2024.
This is Ragini Bhakta, the treasurer of NVSHP. Welcome to another episode of Better Left Unsaid.
Welcome to episode 10, A Day in the Life of Dr. Splinter.
Jared is joining us on Zoom, and he is a transplant clinical pharmacist at University Medical Center of Southern Nevada.
Your path to your position is unique, and the position itself is also unique to Southern Nevada. We want to get to know you and what a day of viewing you is like. So we're going to get started, Jared. Tell us about how you got this opportunity to be in transplant pharmacy.
Excellent. Hi, thank you for inviting me. I really appreciate the opportunity to share with everyone out there. My journey as a pharmacist began really early on after high school. I started actually pushing carts at a grocery store, and we were doing really good and everything. And they promoted me and one of my buddies, and they said, "You guys can pick any position you guys want in the store." And one of my friends went into produce, and I said, "I'd like to try pharmacy." And so I started off at Smith's at Craig and Rancho, and
no way.
Really cool opportunity. And then I got my technician training license from them, and I eventually moved on to agency work with pharmacy. And so I started to get into different hospitals. And so I was able to do some agency work at like Sunrise Hospital. I worked over there and did some like overnight shifts with like their robot doing different things. And I started to do a lot of IV medications and things and compounding. And then I said, I'm around all these pharmacists and it doesn't seem like they're doing anything. So I'm like, why am I working so hard as a technician? I should go to pharmacy school, right? And so I said, might as well apply. And I applied to Roseman, and I got into school in 2009, and I graduated from Roseman in 2012. And so I started as an intern at UFC Hospital when I was in pharmacy school, which was a really cool opportunity. And then when I graduated from pharmacy school, I started as a pharmacist here at UMC. And then when I first graduated, my first night as a pharmacist, I ended up working overnight graveyard shift doing ICU. And so I was covering NICU, I was covering PEDS ICU, which is a really scary position, especially your first night, because when you're first shift, you start working, your orders no longer need verification from anybody. So whenever you press enter button, now it's in play. And so the patient gets that medication, and that order is being executed. And so the second night I started working as a pharmacist, I was training another pharmacist that was 20 years a veteran of pharmacist. And so pharmacy profession, a lot of times trial by error, you just get thrown right into the mix. And so that's kind of how I started with pharmacy at UMC. Shortly after, one of our pharmacists that was doing oncology was he was moving positions. And so he went to North Carolina, and the other oncology pharmacist was moving up to Washington. And so luckily, our pharmacy director at that time was asking who wants to try oncology pharmacy. And so I raised my hand. I was like, let's give it a go. And one of my other colleagues that we both graduated the same year, both of us were working at UFC, she ended up taking the opposite position of me. And so,
wow,
really cool opportunity. So neither one of us did residencies, and both of us ended up in really specialized positions. And so she's still active at VA, and she does oncology over there.
Oh, wow.
And then I did oncology for several years after.
Wow. That's so interesting. The episode before yours, we talked to someone who also had a connection at Sunrise. So that's super interesting. And all the different things, like some of it probably even from the previous person, right place, right time, maybe. But maybe even more than that, like just taking a chance on yourself, Yeah.
It's a scary position because oncology, there's so much risk with chemotherapy, and there's so much room for error. And so I remember the first couple of shifts that I was working, one of the oncologists knocks on the door and he goes, "Jared, I want to do ice therapy on one of our patients," right? And I was like, "Ice therapy?" He was like, "Go get a bucket of ice." Yeah. our chemotherapy regimen. And I was like, wow, that's intense. But he just knocks on the door and he was gone in a matter of minutes. And I was like, okay, well, better start picking up the ropes and jump right in. And so so I started to do oncology here at UMC, and then I started to look even further. I was like, who's doing oncology for all of the hospital, right? And so I started to just like run some reports, and I would look for patients that were getting chemotherapy across the entire hospital. And so I found myself dealing with pediatric oncology. And so, of course, the pediatric pharmacists were like, we would love for you to do our work, essentially, but they would love for us orders, right? Like anybody would let you do their work if you ask. And so I started doing pediatric oncology, and that's when I started to think about like an oncology stewardship. And I think that's a little bit before its time because we don't see oncology stewardships in pharmacy as much, but I think there's definitely a spot for that. And then unfortunately, things changed in oncology here, but, and I ended up where I was at like a crossroads. Where am I going in my career and everything with oncology? And so one of my good friends was retiring from transplant pharmacy here. He actually precepted me when I was in pharmacy school. So I did a rotation with transplant.
Wow.
And so, yeah, he was retiring. And so he said, if you want to apply for the position. And then I landed in the transplant pharmacy position here.
Isn't that amazing? Like 1 6-week experience. Yeah, I mean, first of all, you must have done really well on the rotation for the preceptor to remember you.
Awesome. Yeah. The team here is great. The transplant team is amazing. And, it's just blown up and really promoted. And a lot of cool people here and just excellent program.
I personally have known Jared for 20 some years. And I think one of the things that always has stood out with me with Jared is that his perseverance to be able to find the bright part of wherever he's at. I knew him as a pharmacy technician, and then as a pharmacist, and now a specialty pharmacist, and now he's in kidney transplant. And I just thought, what an atypical way to get to a specialty position, but so doable because he had the right mindset. So it's a pleasure for us to be able to talk to somebody and for you to hopefully give some pharmacist who doesn't want to do a residency some hope about their future in pharmacy. So I'm glad that we reconnected and
yeah, absolutely.
Yeah. So
even pharmacists who, I mean, at least I have had times in my career where I feel kind of stuck, and even if you've been a pharmacist for a while, it's still there. If there are opportunities out there, you can still learn new things and change what you're doing to add some fulfillment to your life as far as your career goes. So that's, I would say, pretty inspiring, Jared.
So Jared, do me a favor, walk us through what a typical day looks like for you when you arrive at work.
Yeah, absolutely. So when I come into work, usually I split my time between our transplant clinic and our inpatient rounds. And so each morning I go on interdisciplinary rounds with the team. And so we have some surgeons on board. We have our transplant nephrologists on board, medical residents. We have fifth-year medical residents. We have medical students from UNLV attend. We have transplant nurses there. We have dietitians that are with us. And so we do an interdisciplinary approach round for each one of our transplant recipients. And it's a really cool team, and everybody at the table is contributing to this patient's care. And so really unique because I've been in lots of different settings in healthcare. The transplant setting is just phenomenal. And I think that's why the patients are so successful here, is because you have everybody else participating in there. So that's why they do so good. So after I do rounds, usually we do table rounds, and then we'll go bedside and we see each one of the patients and talk to them and their families and their caregivers. And we'll use interpreters if it's needed. We have patients from all over the world, essentially, that come through. And we have really interpreter staff that helps out. And it's really cool doing the bedside rounds as well. Once we do that, then a lot of times I prepare the patients for discharge with the team so that we can make sure that the patients are going home successfully with their medications, and we do bedside education and do that. And so we spend a lot of time with the patients, and then we come back to the clinic and we'll see patients that are in the clinic. And The patients that are in the clinic include like pre-transplant patients, so patients that are on dialysis and that are coming for evaluation to see if they can get a kidney transplant and make sure it's safe for them. And then we see patients that are post-transplant, so brand new, just went home from the hospital, to patients that maybe have complications that we'll see in the clinic as well. UMC, we follow the patients for 1 year after transplant, and then they go back to their community nephrologist.
Oh, that's so interesting.
So it's a really cool position for here that we can do inpatient and outpatient. And I have the opportunity to do both, because a lot of centers have multiple pharmacists that will be there, and you have patients or pharmacists that are just designated to the hospital, just designated to the clinic, and I have that unique opportunity right now that I can do both.
I imagine it would be so cool to see someone who got the new organ, and then when you get to let them leave the clinic, after a successful year, that must be very fulfilling.
It's really rewarding that you can see, because the patients come in, they might not be, fully functioning or anything like this, and it just completely changes their life around.
Gosh.
It's really cool to see that.
Yeah, so that's awesome.
We also do a living donor program as well. So some patients are on dialysis or something, and maybe a family member or somebody out from the community wants to give in a kidney, and that's something they could do. And we just started actually doing pancreas transplants as well. The last year.
That's amazing. So like kidney or kidney pancreas?
So we've had kidney and pancreas, so it's like an SPK, simultaneous kidney pancreas. We've had PAK, which is a pancreas after kidney transplant, and we did a pancreas alone just recently, which was really cool, and the patients are all doing amazing.
Oh my gosh, how exciting. So even within transplant, you're like still evolving, and I imagine that affects, things that a pharmacist would do, like medications after the transplantation. That's awesome.
Jared, how many transplants does UMC typically do annually for kidney transplant?
That's a good question. So when I first started, we were doing about 50, 60 transplants a year back in 2018, 2019. Mm-hmm. When COVID hit in 2020, we only did 9 transplants from January 1st to July 1st. Wow. And then we had a new surgeon that came across, and we started to take COVID positive kidneys, which was kind of unheard of at that time. And what we were doing is we were giving monoclonals during that time period to our patients to make sure that we protect them from COVID. And then we did from July 1st to the end of the year, we did 82 transplants during that 7-month period. So all the years before, we were doing 50, 60. And that 6-month period, we did 82. And then it just hit the ground running from there. And so last year, we had about 170 transplants that we did.
Are you kidding? Wow.
So, yeah, really exciting, really huge growth, amazing team. Everybody's really, really good players together, and everybody does really well.
Yeah, and I would say needed for the community, obviously.
Yeah, absolutely.
That's amazing. Well, I think we kind of said at the top of the show, that at least from my knowledge, you are in a very unique position for Southern Nevada. I don't know if there's a counterpart for you in Northern Nevada, like Washoe County or anything, but please correct me if I'm wrong. Are you the only transplant clinic in town?
We are. So Nevada only has one transplant clinic that's at UMC Hospital. Okay. So we have patients from Utah that come through. We have patients from Arizona, California that come and get kidney transplants here. So really cool opportunity for everybody that we get to provide services for those patients.
That's awesome. So maybe just for the audience, just because this is such a unique position, what can you think of might be some pros and cons to what you do?
Pros would definitely be just the involvement with interdisciplinary team. I think is amazing, right?
Yeah.
So as a pharmacist, we interact really well with patients, and that team is good in supporting the providers and the nurses in providing the education to everybody and making sure that we're all on the same board with guidelines and recommendations. I think is really awesome environment. The cons would be the limit of time, right? I mean, everybody, is still in that same 24 hours or that same shift that you work. And so also resources might be a little bit, limited and things, but I don't have any like cons with my job. I mean, the team is amazing. Great support from management and everybody. I have students that come and do straight labor, which is amazing.
Love those students.
And so that's always really cool. But I love. At first, when I was starting, I was thinking like transplant's going to be boring. There's 6 medications, right?
Yeah.
And I came from oncology where there's like a lot of groundbreaking things, but transplant's such a new to the healthcare arena. I mean, we've been doing it for 70 years. So there's a lot to learn about transplant.
That's amazing.
Yeah. So, Jared, if we were to ask a transplant team member the impact of your service on them, what do you think they would say about you and your position?
I think that everybody realizes the importance of each team player. Right? And so I think that the reason we function so well is because of each one of us. And so pretty much it. I don't know what they would say. Probably that I run through the office. They'll get ran into almost just because we're running back and forth from so many different tasks. And
do you wear anything to monitor your steps?
I do. I have my phone.
Oh yeah. I'm guessing you easily hit your goal, which is the back and forth.
And then there's another question I have about your KT transplant families and the patient. How long do you work with them pre, during, and post? What is usually that time frame?
So we have a pre-transplant department here that does a lot of the evaluation. So to kind of break it down, so the dialysis center will send us the referral for the patients, and then our pre-transplant team will just help to get the patient into the clinic to do an evaluation. So my role as a pharmacist with the team is just to make sure that the medications a patient is taking won't be a contraindication for a transplant. I like to make sure that our surgeons know if any of our patients are on medications for like blood thinners, or if they're on anything for maybe like hypotensive medications like Midodrine or Flornef, just to make sure that there's no complications after surgery. A lot of times I just share with the patients that there's risks with anything, right? And so making sure they're aware of side effects that can come from the medications is really important, because some patients that are not diabetic do leave the hospital on insulin. And so that's a new thing. You think, I'm getting a kidney transplant and now I have to take insulin. But our goal as pharmacists is always to reduce the amount of medications people take. And so that's what we continue on here. And so I just let them know in pre-transplant that there's side effects to medications, make sure that I update any medications, your med reconciliation on those patients. And then when they have their kidney transplant in the hospital, then I'm there along that journey too, making sure they have their medications at bedside, make sure that the medications that they're getting are appropriate and they're dosed appropriate, and continue that on in that journey. And so pre-transplant, I see the patients. Post-transplant, I see the patients. And the patients come here so frequent that we're all on a first name basis with all the patients.
That is so cool.
Really cool.
Yeah, that is so cool. Kind of related to that, I guess, if anyone is thinking about going into, I'm calling it transplant medicine, I'm hoping I'm using the correct terminology. What skill sets do you think are important for a pharmacist who's working with a transplant team?
I think that the most appropriate pathway would be through a residency and then a residency specialized in kidney transplant or in transplant in general, right? Mm-hmm. That's going to be the way that they're going to be able to kind of handpick their job, because I think that as the transplant community is growing and we're seeing more, there's going to be more positions as transplant pharmacists participate more in their values understood, then there's just going to be a need for more and more. Mm-hmm. There is a non-traditional pathway where, you have the pick-me people that raise their hand and then jump into positions just through opportunity, but that's not your normal, right? I wouldn't recommend waiting for something like that. I think that you should be proactive, do a residency, apply to programs with transplant programs, for PGY2 and then pursue it like that.
Yeah.
Well, I mean, I think one of the reasons we wanted to have you on the podcast because we thought so highly of your path because it is non-traditional, but good advice for future pharmacists to do the residency training. But it's been fun having you on our podcast because we wanted to highlight really if you are the only transplant pharmacist in Southern Nevada. Wow. Like you should feel I'm proud of you and you should feel very proud.
I taught Jared too.
Yeah.
For a little bit. Yeah.
I never taught him, but yeah. I just think,
you taught me. Come on now.
well, that's right. That's right. I mean, you were just a young pharmacy tech. So, but super proud of you. And I think UMC is very lucky to have you for just about any of the positions that you did do with all of them. And that's kind of the beauty of UMC. They allowed you to train in a lot of areas. So that's awesome. So thank you so much, Jared, for joining us. Nevada really is a unique place for where there's room for growth within pharmacy with the right attitude and willingness. And that's really just speaks volumes to you. So kudos to you. We appreciate your time.
Definitely. And it's also kind of exciting to hear that transplant pharmacy is growing even in Nevada, because the perception sometimes is that we may be flat in that area. So it's really exciting to know that things are growing.
Well, that's it for Better Left Unsaid.
Thank you. We just wanted to give a shout out to Ron Herbs from Roseman University. He does all of our audio and video editing, and we definitely appreciate him making us look and sound good. And the music credit goes to Damaris Morales, who is a classically trained pianist and Ron's wife.
Look for emails from MVSHP about our next snapshot in the coming weeks.
And thanks to all of those who have already renewed their membership or joined NVSHP. It's not too late. If you want to join, then please do so. Visit our website, nvshp.org.
Thanks for listening.
Bye, everybody.
Join us next time. Okay, thanks,
Thanks,
Jared. Have a
Jared.
good one.
Thank you. All right. Bye-bye.